So what we do know is that LGBTQIA plus individuals seem to have a higher migraine burden compared to heterosexual cisgender counterparts, and a significant amount of stigma and a previous history of discrimination, often within the healthcare setting. So many of these patients often are either delaying, access to care or avoiding care altogether for fear of being judged or mistreated. And so many of these patients, by the time they reach a headache specialist, often have been dealing with their symptoms for years and without being treated, maybe further along in their disease condition or course, and maybe a little bit more difficult to treat, more frequent attacks, more disability. I mean, there are so many kind of aspects to this. And I think, they do have a unique, situation, especially in terms of prior stigma, because we know stigma can worsen migraine outcomes regardless of gender identity and sexual orientation. And then when you add the stigma of gender identity and sexual orientation to that, we don't have explicit data about this, but we suspect that it can kind of twofold increase, migraine burden and disability, which obviously can affect their ability to function, go to work, go to school. So it is a huge problem, and something that I think we can do a little better about educating providers and understanding what their unique needs are so that we can meet them in a better place to offer more informative care.